Hello, everyone. It is February 14th, 2023. Happy Valentine's Day. I guess I'm wearing my holiday appropriate sweater. My name is Kristy Bird MaKieve, and I am the CEO of Healthy Rural California, as well as the Executive Director of Butte-Glenn Medical Society and the North Valley Medical Association. It has been a whirlwind of things happening, some really great stuff. So I'm happy to take this time and share an update with you for these three organizations. First and foremost is the celebrations and the good news. So let's start with Healthy Rural California was awarded a $2 million grant from HCI, one of the state departments on healthcare access, and I forget what HCI stands for, but it's the new name for what was previously known as OSHPD. So more acronyms. The $2 million is essential for us to launch our family medicine residency. Healthy Rural California is a consortium model sponsoring institution. We have a sponsoring institution site visit to hopefully confirm our accreditation on February 28th. So we are working very closely with our Graduate Medical Education Committee, also known as GMAC, to prepare for that site visit. They play a very important role in providing the guidance of our policies and everything academic related to our future residency programs. And being a sponsoring institution is a bit unique for a 501c3 nonprofit with no clinical facilities, but it is a viable way to bring graduate medical education, especially to more rural and underserved areas. There is no medical school in Butte County. Actually, there's no medical school between Sacramento and the middle of Oregon, which is a vast territory. And I'm sure if you've listened to my updates, you know I've said this before. Well, there's also a very few large health systems, particularly in Butte County and its neighboring counties. So we're very proud of the work that we're doing to establish graduate medical education. It's a very, very important engine to turn around access to care issues. So we're very proud of our future 28 residents. That'll be 16 in psychiatry and 12 in family medicine, possibly more. We are partnering with a local independent hospital called Enloe Medical Center that's located in Chico, an urban city, an urban zip code, not a rural zip code, but still serving patients from the 9 counties surrounding Enloe Medical Center, which are many are even frontier, and not, it's notch above rural is frontier. So we're very proud of our partnership with Enloe, and we hope that they will be our primary hospital for family medicine. And we are in the planning phase of the family medicine residency. We are hopeful that the curriculum will be strongly focused on integrated behavioral health. We're hopeful that the family medicine residents will be aligned with the psychiatry residents, really providing a unique and exciting opportunity for learning for these residents in the future. So the $2 million HCI award is wonderful news. It helps us get all of these details in place. The family medicine curriculum that is required for accreditation is rather complex. There's a lot of different specialties that have to teach and train the future residents, and they have to be board certified, which is also a hurdle sometimes in more rural areas. Sometimes there are physicians who are not board certified, and they would then not be qualified to be the core faculty teaching the residents. But we're working through it, and the $2 million really helps. $2 million also helps financially. We're looking at the CMS reimbursement rate financial model for the family medicine residency. Side note, for psychiatry, we're going to be pursuing the teaching health center funding, which is a flat federal grant per year per resident. And we think that the CMS reimbursement rate makes more sense for the family medicine resident and any other sort of like internal medicine or general surgery, whatever we choose to partner with Enlo to pursue. So I covered a lot of material in that, but basically when you use CMS reimbursement rates, that funding does not kick in until 6 months, possibly a year into the first year of the residency. And so launching through the planning phase, hiring the appropriate staff, you have to have a program coordinator who's pretty much full-time dedicated, which is, a considerable amount of money up front before the residents even arrive. There's a lot of work in getting into the first, match day program cycle. And I'm blanking on that particular acronym, but it is a particular software that we have to get into the September prior to match day, which is in March. So, and there's just a lot of paid people that have to be on board in order to be successful with the accreditation application. And so where the $2 million grant is very helpful. It's also helpful because we have a HRSA grant. The federal government started us on an award on August 1st, 2022, $750,000 to plan this family medicine residency program. But they require that 50% or more of the clinical facilities are in zip codes, 50% plus of the rotations are at clinical facilities in rural designated zip codes. And because we're partnering with Enlo, that would mean it is an urban zip code, and the majority of the rotations are with the hospital. So this state award really does help us get through this planning process and launching the residency program. And then we will basically give back the HRSA funds, because we will not meet that rural designation by the CMS. There's like if you're curious if whether your zip code is of your clinical facility is urban or rural, you can just Google "Am I Rural?" and that will lead you to a website that has, you just put the zip code in and it will say yes or no and give all the different scores related to that question. And so that's been a huge learning curve for us, that we're in this rural and underserved region, and yet our clinical facilities, which have the capacity, which have the board certified physicians required by ACGME, it is, definitely a high bar to overcome to be 50% rural designated per the CMS zip code designations. So learning along the way, but we're really proud of it, and really, really proud of the family medicine curriculum as it's being developed. We're really happy to work with Dr. Sean Moirano of Enlo Medical Center, who's really, getting the faculty to teach these residents and do something new and change their schedule and really think about, and doing sort of faculty development, learning new things. It's a big lift. And so we're really grateful for everyone that's talking to us about this partnership. And we're hopeful we can get that application in for the accreditation application sometime in May, which could put us on the track to have the first cohort matriculate in 2024. We originally were looking at 2025 because we really hope psychiatry will be accredited. And then that first cohort of psychiatry residents would start in 2024. But we have these amazing new consultants, Germain Solutions, and they are pretty sure we could jump into the 2024 start time. So we're working on it. And the $2 million grant really does help us. And a huge thank you to anybody that watches this. The big problem that I faced in 2019, 2020, and even into 2021 was that there was funding available to launch new residency programs. but the funding would only become available if you were accredited. And to get to that point is like a year or two. It's at least $1 million. For the psychiatry residency, I will tell you, we are hopeful that the Psychiatry Review Committee at ACGME was able to meet on the 10th and the 11th, just a few short days ago. And we're just doing little dances to fingers crossed that we actually get accredited. And that whole process actually started in 2019. I would say there was a year of the pandemic that slowed us down, but when you really think about producing a new graduate medical education program in a completely GME naive area as a consortium model, you gotta, even maybe not even a consortium model, just a regular, clinical FQHC centered or county based, it takes a long time. It takes several years, and you don't want to just put something together and then submit it for accreditation, because they will come and do their site visit and find out that you really didn't get those faculty on board that you needed to. You're just going to put their name out. That doesn't fly, right? So you really do have to take that time and take those steps to engage the community, engage those faculty members, do the faculty development with them. And there's just so many other pieces, hiring the program director, all of that stuff. So just take the time, get the money, and make sure that you are taking the steps that are required to build a strong program. So that is what we're doing. And just fingers crossed about the psychiatry residency. Fingers crossed too that we will pass our sponsoring institution accreditation. That site visit will be February 28th, so coming up soon. Lots of big things to really unpack around GME. So there's other stuff too. So I have to remember to stop talking about GME and talk about other things. But very, very exciting. There's other graduate medical education related programs that we could focus on. There's been a lot of interest in a wilderness medicine. I don't think it's a residency program, but it would be a fellowship or a certificate. There's been a lot of people actually coming out with the need for a master's in public health at Chico State, and a shout out to the CSU Chico Public Health Administration bachelor's degree. I just heard on Friday that they were accredited, and I don't know that accreditation world, but apparently they're the only one at a CSU in California. Well, CSUs are in California, but anyone in the state that has been accredited for this undergraduate program. I think that's what it was. But anyway, shout out to Amy Castelluccio and the team there. Dr. Miller's teaching there, Dr. Schroll. So that's just a wonderful thing. And then to ponder an MPH to be with the family medicine residency, possibly psychiatry MPH. Cool, that would be cool. So we're, there's just been this these ideas that are very powerful, and I'm hopeful that we can partner together and help make these things possible. The MPH is a very important degree, and many of the doctors that I work with know through the different networks, the CMA, BGMS, and BMA, many of them as leaders have an MPH. And so I think it would just be such a powerful recruitment tool to have the psychiatry residency, the family medicine residency, an MPH, and you could all learn from one another and do different electives around those three different things. Or throwing in wilderness medicine too, for those who, Northern California has plenty of opportunity to hone those skills as we all head out to the snow and do some things that maybe our bodies aren't prepared to do, breaking bones or, getting hypothermia and things like that. So Healthy Rural California is also stepping into what is called the undergraduate medical education space. And for those of you who don't know, when you go from undergrad pre-med into a medical school is actually called UME, undergraduate medical education. And so I didn't know how labor intensive it is to host one medical student for 2 weeks, but we are super excited for a medical student to come from UC Davis School of Medicine, February 27th, and for 2 weeks following. She's really interested in psychiatry and could be a candidate for our future psychiatry residency program. And so we thought it best to step into this space, even though we're all stretched thin. We're still trying to hire staff to support all of these efforts that we're doing. And also getting the funding in place to hire folks. Medical school. So we have been working with UC Davis. They have a compadre program. And so this student is coming through to us from the compadre program. Tapping into that network, Dr. Rachel Mitchell, who is the APD of the psychiatry residency and is also one of our GME leadership team. She's amazing. She has really tapped into the compadre program and is connecting these medical students with us. But we've had conversations about what it would look like to have 20 students from UC Davis in their 3rd and 4th years doing their clinical rotations in and around the Chico area, which would be very phenomenal. Just what a great concept and so much need, both for the medical students for their clinical rotations, but also for our area to really woo those medical students to eventually practice in the area. But now we're going to have residency programs. So there's this sort of pathway that's unfolding for the majority of, high school into pre-med at Chico State, first 2 years of medical school elsewhere in Northern California, but then back in the Chico area for years 3 and 4, and then to stay for residency programs. It's very powerful, extremely powerful for that pathway to just be a beacon for youth or for somebody from outside of the area, but who has an incentive and interest in serving in the area as a physician. So very exciting. And we're also talking to Touro University College of Osteopathic Medicine. And that would also be along the same lines. They're looking at about 6 students of a hub. So we are seeking at Healthy Rural California to hire somebody who can, at least part-time, really focus on all of the paperwork that's needed, making sure that the students come to the area and have housing. We're seeking some homestay opportunities if you're in the Chico area and could offer a place to stay for a medical student here and there. We're going to build a list of potential candidates. I know a lot of doctors actually do open their doors to bring in a medical student for the time that they're in the area. So, but wow, I mean, that's like a huge, that could be potentially 26 medical students per year coming through our doors. So funding to pay for somebody as a coordinator position would be amazing. I mean, we're sort of at the moment just kind of calling it a UME coordinator, but my goodness, I'm starting to get anxious. At the BGMS board meeting last week, a doctor said that we should consider years 1 and 2 eventually, and why not? That just made me sort of clutch at my neck, yes, right, it would be fantastic. I'm not sure we have the faculty resources, but we're basically building a medical school with GME first, already stepping into UME. What is possible? Also this week, so speaking of all these students, right, 28 GM residents, potentially 20 to 30 medical students. I mean, right? So what's the next question? Where are these people where's their hub going to be? And so we've moved into this fantastic suite. We're in Miriam Park in Chico. And it's a great it's a really beautiful space, but it will only hold so much. And so we have long been looking at a concept. It used to be called the Health and Technology Education Center. And that was based in 2019, based on the need to promote telehealth. And then the pandemic hit. We all know telehealth went from 1% utilization rate in the country up to like 100%, and is now somewhere much closer to 100% mark than where we started from in 2019. So the concept of this building, though, is still very much needed. And just yesterday, Rachel was able to submit an application to CERF, C-E-R-F. That's through the economic development channels, the Department of Labor, and then our region is called now the North State region of the economic development world, and that consists of 13 counties. I don't think Yuba County got into that, but we're in those spaces already because of Healthy Rural California and our medical society affiliations. So it all made sense to ask CERF for $200,000 so that we could plan this building. We've had a steering committee, we've had great concepts, we have a very key partner in a rural sim center through Chico State School of Nursing. And so this building would be the medical students, the graduate medical education, the sim center for interprofessional learning. We would have a big sort of a flexible learning space, auditorium for community health and public health outreach. I don't know, the MPH, maybe that goes in there too. So we just need to get some final plans so that we can submit for federal dollars that would definitely be there for healthcare workforce infrastructure. And that we really want this building to be in Merriam Park. There's tons of great parking, a variety of housing options, which is why we're targeting that area for graduate medical education. Our residents could be, late 20s or maybe into their 30s. They have a family, they don't have a family, they're getting married, they're having children. It's a very dynamic point in their lives. And so they could need anything from a 1-bedroom apartment to a house that has, could hold 4 children and their family. And so Merriam Park has all of those different housing options. That's why we're there. So the Health and Technology Education Center is now being called the Rural Health Innovation Center. So the Rural Health Innovation Center would also have a research sort of innovation lab. We need to do more research for our residents as part of their curriculum, the pre-med students at Chico State. There's a whole bunch of opportunities. And so our research task force is really spending this year, 2023, looking into what that would be. So you think, okay, that's enough. We're already doing enough. But the team is dynamic. We now have Callie Erner. She is our new controller. So keeping all of these, we've raised more than $5 million in grant funding. Once the psychiatry residency is accredited, knock on wood, this month, we would be able to draw down an HCI fund that was awarded to us in 2020, but under the stipulation that we were accredited. So that thank goodness for Callie coming on board. She's really getting us set and tying up some loose ends. We also have 2 grants to support the youth prevention coalitions. Healthy Rural California is really pleased to have these 2 awards, and to focus on supporting informal coalitions and the good work that's done. And we are hopeful to present a new award. I need to run this by the Healthy Rural California board, but this award would be for an impact award, and basically recognizing Healthy Rural California grant awardees and the good work that they do. The GME committee through Healthy Rural California as a sponsoring institution for graduate medical education. The GME committee has a GME Leadership Award. So I mention all of this because on April 12th, we will be having a dinner somewhere in Chico. Bridget is hard at work trying to find that great location. that will hold all of this. And the Impact Award, the GME Leadership Award would be presented, as well as the Butte-Glenn Medical Society Scholarship Awards. And BGMS's board met last week. I think I mentioned that. They have decided to present Emily Winch, a senior in high school, the $2,000 award for pursuing medicine. Congratulations, Emily. We had such great applications this year that the board, based on the committee's recommendation, was to also award $500 to Skylar Grandlin. So both Skylar and Emily had very impressive applications and are already on the track to becoming physicians. And so we're really pleased to support them on their journey. So they will be hopefully joining us April 12th for the dinner and to receive their frame certificate and their awards. In addition, we give out a senior pre-med student at Chico State a similar award as well. And this year, Sharon Mai of Chico State will receive the $2,000 award. But in addition, we had a very impressive application from Charlotte Park, who is finishing up at Touro University College of Osteopathic Medicine. She's from the area and is going on to residency. And so the committee was also impressed with her application and are going to present her with a $500 award to just give her some step up as she goes into her residency program. So that was a very exciting announcement. I will be doing formal announcements later this week, hopefully when I get their pictures and can do a press release. But that's wonderful news, and congratulations to Emily, Skylar, Charlotte, and Sharon. So good work, and think of Butte-Glenn Medical Society as you continue on your journey to becoming a physician. These scholarships are part of our Med Ed program. The Med Ed program is designed to help middle school, high school students sort of get the resources that they need and into their undergraduate degree with pre-med focus on into medical schools and into the residency programs. And there's so much going on. So looking forward to April 12th. One other thing that I wanted to mention with Butte-Glenn Medical Society is that Bridget and I are really excited to host our first golf tournament, and that is being scheduled on Monday, May 8th. We really need a sponsor. We're looking for a title sponsor at $10,000. This is our first golf tournament, so we're coming out of the gate and wanting it to be strong, and one of the premier golf tournaments will feature many physicians, but it's not just physicians. So we're, looking for anyone to participate and help us raise money. But those funds would be helping to bring in the doctors needed in the region. And for those of you who live in the area and know what I'm about to say, it will ring true that we need more doctors. We need more primary care physicians. We need more specialists. We need more psychiatrists. So we are trying to raise those monies to help us do our good work, and things like the scholarship awards, funding to pay for our positions as we go out to the middle schools and the high schools, going out to career fairs around the region and really getting to know all of the different medical students, and then helping build the residency programs, actually building the engine to bring more doctors to the area. So May 8th at Butte Creek Country Club, and it's a very nice course. A lot of people like to play it. It's members only, so it's a very unique opportunity to get to support our good work, but also play a nice golf course. So nothing else going on. So March 11th, just a month away, is our first community health fair. we are so excited to do these health fairs. They are essential. The local health insurance companies have not done them. There's been a pandemic, of course, but there's also a transition from to payers to we're going to be transitioning to partnership health plan in 2024. So there's kind of just been a lack of doing, prevention, screening, reaching out to people with important information about their health. In addition, with our passion for doing this, we're going to create a podcast series. The name is loosely going to be like, how to be healthy, or, better health, or something like that. And we're going to focus on topics like the importance of relationships for your health, the importance of advocating as a patient, and how to advocate. The healthcare system is not really a system, and so there's a lot of things that individuals need to know in order to best get a quality of life together. I do want to also talk about value-based care, and that, the actual equation of value-based care, it sounds so highfalutin, right? It's like great, but what it really means to us as individuals, as patients in this world, as community citizens, the emphasis is on the individual to also do those things that they should do to be healthy: quitting smoking, exercising more, eating, balanced meals, not getting obese. All of those things like that literally a doctor and a nurse can't do, we need to be doing that. And that's part of this equation of value-based care. And so we think our podcast is going to be super awesome. And we're getting excited about it. Okay, so I think I've covered most things right now. When we had our dinner at North Valley Medical Association on February 2nd, the CMA president, Dr. Donaldo Hernandez, came up and gave a very nice talk. And anyway, it sparked my thinking of, the dinner itself, we had almost 90 people attending, which was phenomenal, especially since NVMA hasn't had board meetings in a couple of years, or the capacity to do events. We raised, I think, about $5,000. I still have to do that financial report. And so it was just a really nice dinner, and we really appreciated the sponsorship from MIEC, from Partnership Health Plan, and from the CMA president coming all the way up to Reading to be with us. And we look forward to doing some more planning with them. They just had their first elections in a long time, and so Dr. PK Danica is going to become the president. Dr. Reeder will retire. And so in honor of the great work that 3 physicians in particular did over the years, we presented a new award called the Building Bridge, I knew it was a B, Bridging to Better Health Leadership Award. So Reading is known for its Sundial Bridge. And when we adopted North Valley Medical Association last fall, it was on like the window of their office space, Bridging to Better Health. So we thought that was a good title. And that award was presented to Dr. Bill Reeder, to Dr. Debbie Lupeka, and to Dr. Ron Reese. All 3 of those physicians, and many others, but those 3 in particular, are still on the board and still active within the CMA House of Delegates. And so it's just been really great to get to know them, and in honor of their hard work and dedication over the years, we wanted to make sure that they got that award. So that was wonderful. Okay, I'm going to wrap up because I'm hungry for lunch. But just so much wonderful stuff happening. And if you have any thoughts on how to partner with us, please reach out. There's one more thing. So we attempted to step into the nursing education world, specifically with a Department of Labor award. We did not get it, but it made me think about, it's not an easy equation to just expand nursing education. So the BSN at Chico State is phenomenal. It's very competitive. They have like 600 applicants. Most people have to wait up to 7 years to get admitted. So there's this huge demand, but you can't just increase the number of slots, right? You have to have enough faculty to teach. And so that is definitely a barrier to expansion. So we partnered with the School of Nursing at Chico State, and in particular, the director, Karen Lightfoot, to create what we want to build, which is a faculty first program, which would be more funding for nurses to go get their MSN, which would enable them to teach at the adjunct level, but then they have to leave the area to get a DNP or a PhD to become tenured faculty. And so, just providing that additional funding, there isn't a DNP or PhD yet in our backyard. So, just helping move nurses out of the clinics where they can make a substantial amount of money and pursue faculty positions, and hopefully also advocating to increase the nursing faculty pay so that there could be a stronger pathway to leave the clinic and go into teaching, which would enable the number of BSN students to be expanded and getting more nurses into the pipeline. There's also an LVN to BSN pilot program we'd love to explore. So there's, stepping into that space is really exciting. There's a lot more we could be doing through Healthy Rural California to support nursing education. So that was one thing I just wanted to make sure I put out there into the universe for people to consider. And if you have some strong candidates who live in the Yuba City area, Chico, our offices are in Chico. We are looking for some strong candidates for a variety of positions. So let us know. All right. Well, happy Valentine's Day. I will not take more of your time, but let us know if you have questions.